There is a silent crisis that is affecting millions of men around the world, one that almost nobody talks about enough. And the consequences of this silence are deteriorating the quality of life of fathers, brothers, grandfathers, and husbands. I am licensed practitioner Camilla Beller, and every man over 50 years old must hear this before it's too late. Today I'm going to show you 5 simple and natural habits that can protect, restore, and even save the health of both your prostate and your sexual health. One of the habits is going to surprise you and could be the most important thing you see this year. Look, this is your prostate, a gland that is the size of a walnut and is located surrounding the urethra below your bladder. This is responsible for producing the fluid that transports the sperm. Until age 50, it usually goes unnoticed, but from that age on, watch out, because it can start to grow. You've surely heard this before. I want you to leave it in the comments. It's called malignant prostatic hyperplasia. It is not cancer. It's important to differentiate that, but it can greatly affect quality of life. More than half of men older than 50 years already present enlargement, and by age 70, more than 80% present it. The symptoms appear slowly. Generally, a weak urine stream, difficulty starting to urinate, a sensation of incomplete emptying, and something very bothersome. Nighttime awakenings to go to the bathroom. Many see it as something inevitable, like, I grow older and it will happen to me. But science today shows that it doesn't have to be that way. With the correct daily habits, it is possible to reduce inflammation, improve urinary flow, and take care of the health of your prostate. That's what we're here for in this video. Let's go straight to the first habit: hydrating strategically. What you drink, how much you drink, and when you drink, it can transform the health of your prostate. With age, we feel less thirst, and we usually drink water only when we're already dehydrated. What this produces is that the urine becomes more concentrated, that it accumulates and irritates the bladder, worsening symptoms like nocturia, causing you to get up many times to go to the bathroom. The solution is simple and proven. There is a study with more than 2,000 men that showed that drinking enough water in the morning and afternoon, decreasing the amount at night, decreases the frequency with which you get up at night by more than 40%. So, how do you do it? You get up early in the morning, drink 1 or 2 glasses of water. Every hour you drink a glass, and 2 hours before going to bed, you don't drink any more liquids. This will make it so you don't get up all night. This is such a simple habit that it can reduce inflammation, improve urinary flow, and protect your prostate every day. But watch out, because what you put in your glass is as important as what you put on your plate, and some foods are true natural remedies against prostate enlargement and also cancer. So, let's go straight to the second habit: eating natural remedies, such as, for example, foods that have lycopene. Lycopene is present in tomato, guava, and watermelon. When the tomato is cooked and you add a splash of olive oil, the lycopene is absorbed much better. Men who eat lycopene, that is, tomato or one of these foods, have at least a 28% lower risk of prostate cancer. Add to this pumpkin seeds, shellfish, nuts that have a lot of zinc and that help keep testosterone in balance. And don't forget the cruciferous vegetables like broccoli, cauliflower, Brussels sprouts that help cleanse the body of cancer-causing toxins for the prostate, protecting it. And here goes a little-known secret: saffron. Its active compounds have shown that it can slow the growth of cancerous cells and quickly improve symptoms of an enlarged prostate. Its effect is equivalent to that of the best remedies used for this. How are you going to use it? Incorporate a generous pinch daily. That's about 15 to 20 threads or a quarter teaspoon. If you use ground saffron, you can add an infusion to salads, to your rice. Even if you like it, you can add it to yogurt. With this, you're going to add a powerful ally for the health of your prostate. Now, How are you going to integrate all of this that I just mentioned into one day? What you can do is add cooked tomatoes to your soups or stews. Eat a handful of pumpkin seeds as a snack mid-morning or mid-afternoon. Sauté some broccoli with garlic 2 to 3 times a week, and use that pinch of saffron every day. And if you think eating well is good for the prostate, listen to the next habit. Daily walks after eating. Look, there's a study in Brazil, specifically in São Paulo, that showed that older men who walked 15 minutes after lunch or dinner had a 35% lower risk of having symptoms of an enlarged prostate. Why does this work? Because walking after eating improves blood flow in the pelvis, bringing more oxygen and nutrients to this gland. In addition, it helps regulate glucose and insulin levels in the blood. This is fundamental because insulin resistance and diabetes increase prostate problems, including cancer. This habit improves the health of the whole body because it reduces inflammation. How are you going to do it? Ideally, as I was saying, walk lightly after eating, before lunch or before dinner. It can also be after each meal. But if this isn't possible, do it at any time of day. What's important is to move more, even if it's inside your house or in the yard. Avoid staying seated for several hours in the same position. And as I was saying, you don't need to run or go to the gym. Walks of 15 minutes are enough. And now, although walking is very powerful, there's something that can further enhance these benefits. The fourth habit is sleeping well. We know it's the most underrated habit for overall health, but even more so for prostate health. Chronic lack of sleep raises inflammation, alters hormones, and wears down the body. Deep sleep regulates melatonin and growth hormone, which repair tissues and strengthen the immune system. Look, there's a study that showed that men who slept less than 7 hours per night had more than double the risk of developing advanced prostate cancer compared to those men who slept uninterrupted. In addition, sleeping well keeps testosterone, glucose, and blood pressure levels stable, which are essential for metabolic health. How are you going to do it? Try to sleep 7 hours every night in a room that is dark, cool, and quiet. And if you can, avoid caffeine during the afternoon so you can rest better. Reduce screens 2 hours before going to sleep and go to bed always at the same time. You can also help yourself with a few drops of lavender oil on your pillow to do aromatherapy, or drink chamomile tea or passion flower 2 hours before going to bed. Remember that sleeping is not a luxury, it is regenerative medicine. But pay close attention if you want to give a final touch and enhance all these habits. This last one is unexpected, nobody dares to mention it, and many older men overlook it. But believe me, it is the most powerful for cleansing and de-inflaming the prostate naturally. It doesn't matter what age you are. Look, maintaining regular ejaculation is very healthy for the prostate, as it's one of the body's natural mechanisms for getting rid of waste from this gland. There is a study at Harvard, I'm not the one saying it, the studies say it, with more than 30,000 men. This study showed that those who did it more than 21 times a month have 33 times lower risk of prostate cancer compared to those who did it less frequently. Biologically, this act expels residual fluids, inflammatory proteins, and dead cells that accumulate in the prostate and can cause congestion and irritation. In addition, it improves pelvic circulation, balances hormones, and reduces cortisol and stress. All of these are related to chronic inflammation. That's why I tell you, it's never too late to take care of your intimate health. And if there is pain, difficulty, or low libido, talk with your doctor. Go ahead. Let this no longer be a taboo topic. It is extremely important because it affects your health. Yeah.